Okay, good morning, everybody. Welcome to Coffee with C.A.R.P. My name is Laura Ross-Giroux, and I'll be hosting this presentation this morning. We're going to be discussing exactly what a seniors advocate is and why Saskatchewan needs one, and also how you can help bring about a seniors advocate to this province. So know that throughout this presentation, I'm going to be interchangeably using the terms Office of the Seniors Advocate and Seniors Advocate just as it is. So without further ado, we shall get going with this. Okay, can everybody see my screen?
Not yet.
No.
Okay, hang on. Believe me when I say I'd rather do this in front of a room of live people than online. I'm not very good with it. Okay. Let's try this again. Can you see my screen?
No.
No.
Oh, for heaven's sakes. Okay. Let's try this one. How's that?
Yeah.
Yeah, now we see it.
Okay, great. Okay, so we will start our presentation now. So just a little background on exactly what is C.A.R.P Saskatchewan. C.A.R.P actually stands for the Canadian Association of Retired Persons. C.A.R.P is Canada's largest advocacy association for older Canadians, promoting equitable access to healthcare, financial security, and freedom from ageism. C.A.R.P is a nonprofit organization that receives its funding through membership fees and advertising with our affinity partners. It does not receive government funding. We believe that older adults deserve to age with dignity and to remain comfortably in their own homes as long as they are able. So C.A.R.P has three main advocacy missions. The first being best-in-class vaccine funding for seniors. The first being the high-dose influenza vaccine. The standard dose of trivalent influenza is 50% less effective in those over 65 years of age than younger healthy adults. Plus, adults with underlying health issues like heart and respiratory issues, cancer, diabetes, are at a greater risk to the flu complications. Adults over 65 account for over 70% of influenza-related hospitalizations and over 90% of influenza-related deaths. Through a lot of advocacy, this vaccination has now been funded by the Saskatchewan government in the 2022 budget. And I have to mention that in the this past fall, I was offered the choice for the higher dose or regular influenza shots. The second vaccine we're looking at is the pneumococcal vaccine. Pneumonia kills, though it is rarely the main cause of death. It attacks already weakened immune systems and contributes to many deaths every year. Both the Prevnar 13 and the Pneumovax 23 vaccines are recommended. Pneumonia is the cause of countless visits to acute care facilities, stacking up thousands of hours of medical care and millions of dollars of healthcare funding, much of which can be avoided with regular vaccinations. These vaccinations also need to be fully funded for all adults over the age of 65. And right now they cost in excess of $130 per shot. And lastly, we'd like to see the shingles vaccines funded. 1 in 3 Canadians will get shingles in their lifetime. Shingles is a debilitating, incredibly painful viral infection that can lead to loss of vision and/or permanent nerve pain. 2/3 of all shingles cases occur in adults over the age of 50. The most effective shingle vaccines cost over $300 a shot, and we require 2 shots. Currently, Ontario is the only province that funds the shingles vaccine. C.A.R.P's second priority is long-term care and home care reform. Did you know that Saskatchewan is the only province that has no legislation for seniors living in independent living rental situations? I recently learned of a gentleman who was evicted from his home, his independent living rental situation, because he dared to complain about the way the facility was being run, from lack of fully working heating and cooling systems to qualifications for and accreditations of the staff, for bullying. And when he was evicted, he was given 1 month. And his family took months and months to get recompense from and help for him. They finally ended up having to go through the Office of Residential Tenancies, Saskatchewan Health, the Ministry of Seniors. None of them could help. So this is something that we need to have reforms and basic standards met for all seniors in living in long-term care and with assisted home care. Canada spends 10.7% of its gross domestic product on healthcare, putting us 6th highest among the OECD countries. Yet the health outcomes we receive for our gross overspend are, by any measure, mediocre to abysmal when compared to other countries of similar wealth. But our main priority over the next year is the establishment of a legislative seniors advocate, a mission C.A.R.P Saskatchewan has been working on since 2014. In the fall of 2021, C.A.R.P Saskatchewan entered into a coalition with C.A.R.P Alberta and C.A.R.P Manitoba to advocate for the establishment of offices of the seniors advocate throughout the 3 prairie provinces. And we have the great support of our C.A.R.P national office in Toronto. Currently in Saskatchewan, seniors issues are included under the Minister of Health or Mental Health, Addictions, Seniors, Rural and Remote Health, which is quite a lot to deal with under one portfolio. There's a lack of engagement on seniors issues beyond institutional and privatization of long-term, and there is no specific funding for seniors issues. There's also a lack of a provincial seniors advisory committee. So just who is the minister listening to? Some seniors currently find themselves in the position of paying either for rent, prescriptions, or food. And this dilemma should not exist. Seniors have earned the right to live long and comfortably into old age. Recently, one gentleman approached me as he was worried about his power bill. He had just received one of those catch-up bills from C.A.R.P. He wasn't on a plan, so it was quite a large amount. And he was so worried about how he was going to be able to pay this bill and get his prescriptions and food. This shouldn't be happening in our province. So why is the current status quo insufficient? We are not alike. The government seems to have the attitude of a one-size-fits-all solution. Seniors' needs dictate dramatically different resources and are much broader than just healthcare. Instead of waiting for things to change, we need a proactive approach to address issues of affordability, adequate and safe housing, transportation, and aging in place home supports. COVID-19 highlighted the systemic issues that we are facing, and it was frightening. A recurrent theme that we hear is, they're not going to put me in a nursing home. And we need somebody who is willing to advocate for our needs. Currently, we have several organizations that are advocating for change within the province, but it's also a case of the left hand often doesn't know what the right hand is doing, and several of them do not work in conjunction with each other to assist seniors. We must be planning now to address the physical, emotional, financial, and other anticipated needs of older adults. Again, we need a proactive approach to address issues of affordability, adequate and safe housing, transportation, and aging in place. The Saskatchewan Seniors Mechanism Home Support Initiative, launched in 2021, believes with practical supports, older adults will be able to stay in their own homes longer. We at C.A.R.P support the SSM initiative. And for more information on it, you can go to the SSM website. The mandate of the Office of the Seniors Advocate must be to advocate for the rights, interest, and well-beings of seniors, to champion individual seniors' issues that can't be resolved within the silos of existing government programs. As mentioned, seniors' issues seem to be spread all over several ministries, and the left hand often doesn't know what the right hand is doing. To navigate the system, which is so often confusing for many, the seniors advocate must be able to effect systemic change in government policies, legislation, and programs to better support seniors. The Office of the Seniors Advocate must have definitive powers similar to the Saskatchewan Advocate for Children and Youth. It is an independent office of the Legislative Assembly, and the Seniors Advocate Office should be too. The advocate must be able to influence and affect change in government programs where they're falling short of the needs of seniors. And we should be following the BC model. Currently, BC is the only province that has an Office of the Seniors Advocate that monitors and analyzes senior services and issues for the province. It makes recommendations to the government and service providers to address systemic issues. The office also provides information and referrals for individuals who are navigating senior services and tracks their concerns, which helps inform future work. The Office of the Seniors Advocate in BC monitors 5 key areas: healthcare, housing, income supports, community supports, and transportation. It collaborates with service providers, government, and health authorities to improve effectiveness, efficiency, and outcomes. A council of advisors made up of BC seniors provides the Seniors Advocate with the advice and feedback from a perspective of seniors with diverse backgrounds, ages, geographical areas, and cultures. And as effective as the BC Senior Advocate is, they've just recently asked for a broader mandate because the excellent services they already provide to older adults in BC are just not enough. Looking at our coalition partners in Alberta and Manitoba, there's very little consistency between the provinces when it comes to advocates. We all know that seniors' issues are more than just health. They need assistance in several areas. Although Alberta has a total of 7 advocates, seniors don't have their own when it comes under the health advocate. In 1998, Alberta did have a seniors advocate under the NDP government, but it was disbanded in 2019, December. And during the 16 months that the seniors advocate in Alberta was in place, They addressed over 3,735 cases, far more cases than any other health-related advocates listed above. Here's an example of what we would expect out of a seniors advocate. To monitor and analyze senior services and issues, making recommendations to government and service providers to address systemic issues in housing, income supports, aging in place supports, and transportation. Advocacy, to provide information and referrals for individuals who are navigating senior services and track concerns. To investigate matters concerning or services provided to seniors by provincial ministry, government agencies, or publicly funded health entity. To review programs and policies affecting seniors. And to participate in consultations in which systemic decisions affecting seniors are made. And finally, to deliver public education that promotes the rights, interests, and well-beings of seniors. The seniors advocate must be able to report to the whole of government and not just to the ministry. I have another example where a woman was found to be living in a terrible condition with her son on a homestead. And her son was taking her pension money, and long-term care couldn't step in, and the public trustee wouldn't step in to assist because her son had the power of attorney. And he would always insist on 2 weeks' notice for inspections. So he always got his family prepared, or his mother prepared, for any visits by inspectors. It took 2 years to remedy her situation and to remove her from that abusive situation that she was in. It took healthcare, home care, the police, the public trustee, and finally social services to step in, working together to remove her from that situation. The advantages of an independent office of the seniors advocate. Through legislation, it would enshrine the office of the seniors advocate and would provide protection from the will of changes in government. It would be arm's length from the government, and it would allow the seniors advocate to champion individual seniors issues without bias from the government. It needs to have the independence to report to the public without bias or influence, without approval or editing by the government. In the previous example of the Alberta Seniors Advocate, the final report went to the Minister of Seniors and Housing and was not released to the public. The Seniors Advocate needs to have the report go to the public. The advocate needs to have the power to effect change and to resolve issues for seniors. And it needs to have stability of mandate and not subject to changes in government. Saskatchewan already has set precedent for this through the Advocate of Children and Youth, an independent office of the Legislative Assembly of Saskatchewan. The advocate leads a team of professionals to advocate for the rights, interests, and well-being of children and youth in Saskatchewan, and its mandate is defined by the Advocate for Children and Youth Act. So as you can see from this graph from the 2021 election, those between the ages of 58 and 68 years plus vote more than any other age group. Seniors are one of Canada's largest and growing demographic. Seniors are increasing in number as the baby boomers age, and add to the category of seniors ages 65 plus. 95% of C.A.R.P members vote, and yet seniors struggle to get by in day-to-day living, pay for rent, prescriptions, food, feeling almost ignored by the provincial government. We must start exercising our political will. Seniors will continue to increase their portion of the active voting public. Therefore, seniors' issues will become more important to the governing parties. And also, as you can see from this graph that is specific to Saskatchewan, in the 2015 and 2019 elections, seniors 55 or older adults 60 or 55 plus were still the largest bloc, and yet we're not being listened to. So having a seniors advocate would be a benefit to the government in so many ways. The government would be showing foundational support to a large voting demographic that played a significant role in building Saskatchewan. Removing the burden on other siloed departments who may not understand the interrelationship of senior support programs inside and outside of government. And improving the health and well-being of the senior population, and thereby reducing the burden on the Saskatchewan Health Association and the Ministry of Health. Keeping seniors in their own homes benefits not only the seniors, but their families and community as well. So, as I mentioned, we have a coalition now between Alberta, Manitoba, and Saskatchewan. And with the support of C.A.R.P National, C.A.R.P Saskatchewan is involved in a campaign to ask the Saskatchewan provincial government to create an independent office of seniors advocate. It would be an office without legislative powers, but can act in an advisory capacity to government officials and seniors and their families, and whose reports would be made public to all. So with that intent, C.A.R.P National, along with the 3 Prairie provinces, has come up with a 10-point plan for our advocacy over the next year or two. We'll begin with letters to the premiers of each province outlining the need for a seniors advocate and seeking their cooperation and support in bringing forth such legislation. The local C.A.R.P chapters will initiate province-wide campaigns, including letter writing campaigns, encouraging our members to contact their local provincial members to support and to bring in the seniors advocate legislation. We'll also be asking local like-minded organizations for their help. We will be communicating with opposition party leaders to address this campaign. We will be initiating a media campaign through radio, newspaper, and television. C.A.R.P National will be launching a webpage to outline and to curate the coverage. And as soon as the website is live and up, we will share the address when we get it. C.A.R.P National will start an online petition, and we will be asking you to sign it and to share it. Hopefully, we will have the opportunity to meet with the Premier and the opposition leaders and other representatives around the province. Throughout this, we will be polling our members to educate and to inform them about the need for a seniors advocate and to get a sense of the priorities of our seniors. For example, hospital wait times, access to vaccines, and funding for physical fitness. In summary, having seniors' issues handled under the Ministry of Mental Health and Addictions, Seniors and Rural and Remote Health is short-sighted and doesn't have the breadth of support that is required for seniors. The support for establishing a legislative office of seniors advocate is growing. COVID-19 has highlighted some of the struggles and issues facing seniors today, and all of us currently are struggling with inflation. Long-term care, isolation, abuse, physical, mental, and emotional, and food securities are just a few of the issues facing our seniors. As seniors become more and more the majority of the population, now is the time to push for seniors advocate. So you can, if you would like to assist us with this, please follow us on our Facebook page, C.A.R.P Saskatchewan. Talk with and write letters of support to your local, regional, and provincial officials about the need for a seniors advocate. Get your local mayors and councils involved. The more voices, the louder our message. If you're comfortable in doing so, we urge you to call or write your local MLA and put the pressure on them to advocate for seniors advocacy. And also talk to the circles of your friends and inform them about the need for our seniors advocate in our province. So if you would like to get more involved with this campaign or learn more about C.A.R.P Saskatchewan, you can find us at our website, sk@carp.ca, or you can reach out to us through text or leave a message at area code 639-944-7575. As mentioned, didn't mention it earlier, but this session is being recorded and can be watched again on our YouTube channel, and links can be found on the Saskatchewan C.A.R.P page. And a newsletter will summarize the information from this presentation, and it will be made available through the Facebook pages of our chapter. So I thank you for joining us for this presentation, and I'd be happy to answer any questions that you may have. Okay. I hope that was informative for you all.
Laura, that was an excellent presentation. Thank you.
Thank you, Jim. Well, we must have informed everybody so well. I don't profess to have all the answers. Yes. Oh, hi, Greta.
Hello. Yes, I have to agree with Jim. That was absolutely excellent. One of the other items that we might want to add to the list is the access to services that will assist seniors to maintain mobility. Because if you lose your mobility, your chances of staying home are next to nil. And there just are not enough services unless you have deep pockets and you go to private services, which is your only option. And when people are dealing with all the other issues, I liked your, well, I didn't like it, but I mean, I was really listening to your example about, you know, the gentleman who was talking about the utilities going up. You know, I think my husband and I are being more careful, and I keep looking, we're using less power and the bills are higher every time. And it's things like the carbon tax and the charge for, you know, per unit of use. Like the teeter-totter is so out of balance.
It is.
Yes. This is so long overdue, and I'm just delighted to see the whole screen with so many people who were able to attend this morning. And I just can't help but think this is going to take on a life now.
Oh, we certainly hope so. I mean, we have momentum on our side now, especially with the coalition. We are able to communicate with each other, with the other provinces, and we will be taking best practices from them and using it for our own campaigns. And thank you for the suggestion on seniors mobility. And frankly, I live in a community that at our last meeting, we finally approved the use of electric wheelchairs in our independent living lodge here. It wasn't allowed before. And I'm happy to say that now it is, and mobility is certainly important to our seniors. So thank you for bringing that up. No, there's a lot of work to be done, you know, and a lot, and like, as you mentioned, inflation, it's terrible.
Yes.
I mean, I'm certainly one of those living on a fixed income, and my power bills this past winter were atrocious. And
Mobility, like I just want to
Gas.
clarify, is
Sorry.
I'm thinking of more than just equipment. Equipment's
Of course.
critical. But
course.
just access to physiotherapy that can be effective, because otherwise, what's the option? They'll just keep increasing pain medication. And what does that lead to? We all know the number of people who are drug dependent now, and not through their own fault. There just was no other way to manage the pain. So both equipment, but also physiotherapy services, exercise therapists, those are absolutely critical. And you know what? I can attest to it. Seniors are able to recover. We had a convalescent program where people 90 plus were going into convalescent care and recovering and going back home. So it's possible. It takes a little investment, but it's a huge benefit for the person, their family, the health system, the government finances. It's a plus all the way around.
Yeah, and
Yes.
the current services are just not good enough. I got referred to the pain clinic in Regina. It took me a year and a half waiting to get into it. And it's an excellent service. Yet, but that just doesn't work for everybody. And we need things that are specific to seniors. I quite agree.
Yeah, well, National this year has also informed us that there's going to be a great push on physical fitness and wellness for seniors. And we are asking for more funding for those programs as well. And I noticed in looking around the province at different seniors organizations, the push for walking groups and chair yoga and all sorts of other items, it's becoming more and more emphasized. And I'm so glad that those programs are available, but we can certainly use a lot more. So hopefully we'll get, increased funding or an increased awareness of the necessity of these programs. And this is where, a seniors advocate would be front and center for this. I just want to mention also that if you can go online and check to see the report of the BC Senior Advocate. She had over 70 pages in her last report. So it's really interesting to read about this woman. Her name is Isabel McKenzie, and we're hoping to have her at a future meeting. So we'll see what we can do. Carrie, you have your hand up.
Yes, I actually had a question, just looking for a little more information on the initiative around physical fitness that you've said, I gather, is a national initiative. What does that involve, and what kind of support is C.A.R.P looking for organizations that deliver fitness programming?
It is fairly new. We haven't had a chance to investigate a lot of it right now. I know it will be an emphasis this year for national. I'm hoping that if many of you have Zoomer magazine and have Zoomer TV, they'll be informing us of a lot more. I'm afraid I just don't have all the specific information to that. But once we do get it, I will be putting it in our newsletters and getting it out to our members when we can.
Okay, thank you.
Mm-hmm.
Laura,
Yes.
I really like the numbers that you have in there. We have to emphasize the importance of Saskatchewan seniors as a voting group. Whether we all vote the same or not is irrelevant, but as a voting group, you're looking at a group that, as you said already, most of us vote. And it's a significant part of the voting population. I mean, we're about 17.5% of the population of Saskatchewan. And if you look at the eligible voters, we're in the last election, 2021, it was about what, 880,000. And if you do the math on that, we have one of the largest absolute numbers that can be given to government. Numbers that could represent as much as half of what the Conservatives and all of what the NDP got in the last election. It's significant, and that needs to be pointed out, and politicians need to hear about that, and we need to start making some noise as we're doing. So I think that's a very important part of how we're going to take this forward.
I agree, and frankly, we have to familiarize ourselves with the legislation or legislative building and the people within it. I'm one of those that I lived previously in Alberta, and I traveled to Edmonton at least once a month in my advocacy work in the areas that I was in. And I got really pushy. I went up and I went to the conferences, and I would introduce myself to the premiers and the deputy ministers and anybody that I could find that worked within the ministries that I was looking for. And you've got to confront people sometimes, get right in their face. And I'm surely I'm not the only one in this province that can do it. I mean, you've got to be respectful, of course, but I'm hoping this year that we'll be able to go to the RM conferences and the I forget the terms for them here in Saskatchewan, but the municipalities conferences, and introduce ourselves. I'm hoping this summer also to get up to Regina with the members of C.A.R.P National and to introduce myself to the premier and the opposition leader. And we just got to get on their radar, and also know that as much, and please go to your MLAs, advocate for us. Like, don't make yourself a nuisance, but do it in a very constructive way, and let them know that our votes count, and they've got to start listening to us. But be very, as I mentioned, be respectful and do it in a constructive way, and let's get on their radar. And we hope to do that with the letter writing campaign and the petitions, and as mentioned, go to your mayors and your town councils, get them on board.
Yes.
Grassroots movements start somewhere. Get your lodges going, get your drop-in centers going. Once we have more of these tools on hand with the petitions and everything else, we'll let you know. And we ask you to, share this information around. The C.A.R.P Facebook page is hard to find, but once you find it, please subscribe to it, so you know that we're not the fish. And also the YouTube channel. We have got most of our coffee with C.A.R.Ps up there now. And if you haven't signed up for our newsletter, please do that. I try to get it out at least once a month, and it's full of wonderful information. And you'll be seeing more about the Seniors Advocate Office in our newsletter. And as you can see, I'm not too short on talking. So hi, Wendy.
Hi there. I just saw a question, Laura, about do we have a sample letter? I think that came in from one of the participants. And so I recall it being about the letter writing campaign and 2 MLAs. I imagine you'll be putting that in the newsletter in coming days as well.
Oh, I certainly will. Yes, I haven't run across one yet, but I know Alberta does have one, and we'll probably steal it. And I will put that in the newsletter for all of you to use, and hopefully we'll get this out. And emails, folks, and snail mail also still works for many of our office official leaders, and I'll be putting addresses and email addresses in the next newsletter as well. Any other questions or concerns, or? Well, I must have done something right then.
I'd just like to add, Laura, that I'm really excited. As you mentioned, we've been pushing for this for a number of years, and with this added momentum and the Prairie Provinces Coalition, I'm excited and hoping for great things ahead. And certainly, we'd love any more support. The more hands and more voices we have, this is going to happen.
Yes, and I mean, even if we can, well, I forgot to mention that Newfoundland Labrador doesn't have a seniors advocate, but they have a seniors advisory council.
Actually, Laura, they do have an advocate.
When?
Yeah. It was established around about 2017.
Oh, I'm sorry.
So, but, you know, doing great work in Newfoundland and Labrador as well.
I find it rather odd that, you know, on either end of this country, there's seniors advocates. And yet this great gap in between, there's nothing for us. And we need to fix that. So as you mentioned, we've been working on this for 9 years now. And I think, you know, building momentum now that with the coalition that we finally will make some headway. And especially in Saskatchewan, our election is next year. So, I mean, it's what a better time to start than right now. Yeah. So as mentioned, if you need any further information, I will be getting this out to you all in the newsletter and on Facebook. And, you know, and you can certainly contact us at sask@carp.ca for any further information.
Laura, it looks like Carrie's hand is up. I don't know if
Oh,
that
I'm
was a
sorry.
mistake or
Yes, thank you, Greta. I just wanted to say that Saskatchewan used to have a provincial advisory council on older persons.
Yes.
It was established in the International Year of the Older Person.
Yes.
It did very good work for a number of years, and it ultimately led a very slow and painful death
Right.
when the current government came into power and simply stopped calling that group together for meetings. And eventually they told people that the committee didn't exist. Thanks for your service, but we don't need you anymore. So there is precedent for something in Saskatchewan. There are a lot of people around who were involved on that council that would be good people to involve in this initiative to get something going in the province again.
I did hear about the advisory council, but I was hard pressed to find any information on it. So thank you for informing me of that or filling in the gaps that I had. Yeah, I wasn't sure what had happened to it or the background on it, but
Yeah, it disappeared. I mean, I know several of the people who were involved in the committee over the years, including the most recent chairperson when it actually was disbanded. She herself was with the Ministry of Health for many years and finally said, like, if this committee is not going to function out of respect to the people who are on it, they should be informed, and they were.
oh,
And nothing has ever come to replace it.
well, there you go. We have precedent to build on.
We
Carrie,
definitely do.
if you could please send me your contact information to sask@carp.ca, I'd love to follow up with you on that, please.
Okay,
Yeah, as you can see, well, I'm fairly new to the province. I've only been here 2 years. And I'm still finding my way around. So, you know, as much, I've got a great C.A.R.P board and my learning curve is still very steep. And they've been really wonderfully supportive of me and I'm learning so much. So this really adds to my repertoire of facts. Thank you so much. No. And thank you. Is there anything else that needs to be brought up? I see Colette's joining us. but just at the end. But no, I would appreciate it, all your support. We do have an advocacy committee, and we will be putting out a address that you can join us on. Jim is a member, Wendy, Darlene, Greta Lynn. Yes, nice to see you all here. And yes, we will be looking for all the help we can get. If there's nothing else, then I will call an end to this meeting. I thank you all for joining us. And please contact us if you have any concerns. And yeah, hopefully we'll be reaching out to all of you again soon. And this is our last Coffee with C.A.R.P presentation until the fall. But we will continue to get the newsletters out and working behind the scenes to hopefully bring you great news in the fall too when we come back. So thank you all for joining us.
Yeah, just one last thought. Sorry.
That's okay, Greta.
I'm just thinking that in the meantime, if we want to be speaking to persons or even to groups, and I'm thinking of church associations, places like seniors housing, etc. I'm wondering if we could maybe condense some of your excellent presentation into a presentation, a generic that everybody would have access to, so that the message that's going out to wherever in the province is a consistent message.
Oh yeah, I believe I did mention that at the end, that we will be summarizing this presentation, and you'll be able to use that. You will put it on Facebook, and we'll also perhaps put a link to it on our newsletter page.
Oh, perfect.
We will have a consistent message that you can spread around the province for us.
Perfect. Yeah.
Okay. All righty. Well, thank you so much, everybody, for joining us. And as I said, this has been recorded, so we can go back and look at it again. Thank you so much, and goodbye.
Can you just